Hello, my name is Regi Robnett, and I work for the University of New England, where I've worked for 25 years. I'm a professor in the Occupational Therapy Department, and I'm also the Associate Director of the Center for Excellence in Aging and Health. And today we're going to talk about using standardized assessment tools, why we use them, and what's readily available for you in adult rehabilitation. My learning objectives for you are to be able to think about and describe the advantages and disadvantages of using standardized assessment tools, to identify tools that may be helpful for you in adult rehabilitation, and for you to be able to articulate why continued research on assessment tools is worthwhile. I need to disclose that I have no financial interest in the assessment tools that I'm going to share. Standardized testing for adults is really important. That was recommended by the Center for Medicare and Medicaid Services already in 2012. Some of the advantages of using standardized testing is that documentation is much easier. For example, think about giving the mini mental state examination. If you get a score of 20, you know that's probable dementia, and anyone reading your chart would also know that. You need less clinical reasoning to give these types of tests because you have to follow the set directions and norms. It's very rigid, as a matter of fact. You must follow the rules, but it must not be used as intervention. Nothing drives me a little bit more batty than, for example, taking a piece of the CELS, the Coleman Evaluation of Living Skills, and using it as an intervention. Truthfully, what that means is that it ruins the validity of the test. Non-standardized testing, which most of us love, is much more client-centered. For example, if you want to know how the person can make a cup of tea for themselves, you have them make a cup of tea. What could be better, right? But there are no set norms, and it's difficult, especially for newer therapists, to know what is normal. When I first started with this, I thought home safety meant anybody who was safe in their home was 100% safe in their home. But we all know that we have cords running across the floor, or we might have a rug that might trip on. So what is normal? It's an important question, and it's a hard question to answer. So therefore, using non-standardized testing takes much more clinical reasoning, but it is more flexible, so you only use the tasks that you find important. There are lots of tools out there, and I encourage you to look for really good tools that have good psychometrics. What are psychometrics? Well, that means they're valid, that they measure what they purport to measure. And they're reliable so that they measure what they say they will measure consistently, whether that's cognition, range of motion, or whatever factor you're looking at. You do need to consider cost. It's disappointing sometimes to look through some of those catalogs and see how much they are charging for standardized assessment tools, but I can also understand how much effort went into making those. OT tends to use tools that have good ecological validity. And what I mean by that is that is the real life validity. Our tools use functional tasks, which is exactly what we want to measure, but that also makes it more complex than a paper and pencil measure. Often therapists think, like I did more than 20 years ago, I can design a better assessment tool, but 20 years later or more, I'm still learning how much there is to learn about psychometrics and about assessment tool development. And there's another problem, and that is that assessment tools get developed, but they don't evolve. For example, with the CELS, I worked about 7 years to get Linda Coleman Thompson to update the CELS. Now, it was all about her. It wasn't me at all. I had played a very minor role other than I spurred her on to improve and do the next edition of the CELS. So I would like you to go onto two websites. I was going to actually take you to those websites, but the problem is that in 5 minutes, I don't really have time to do that. So the first one is neattest.com. The tools are there for you to use. They're free for you to use, and we would love to have feedback so they can continue to evolve. There is the Manage Med screen, which is a medication management assessment that looks at the ability of a person to manage a moderately difficult medication routine with 3 different doses, 3 different schedules, and 3 different medications. It's just a screening, and it has been used quite a bit at New England Rehab for their stroke patients. Other assessment tools that are available on there are a new one called the Home Safety Self-Assessment Interview. It really helps you structure an interview about home safety, and it helps you assess the awareness of the person about their personal home safety and gives you things to talk about. It does not do a home assessment, just so you know. Then there is the CHORO, Test of Visual Perception Related to Driving. Well, it's not exactly on this website. The website that it is on this website. How's that for confusing? And then finally, there's the Quality of Life tool. And that's at a different website. And it is the qualot.com, qualot.com Volume 2, which is an interactive, client-focused, occupation-based quality of life tool that can help you with collaborative goal setting for rehabilitation. And what it is there's 43 questions. This is just the beginning. If you go on the website and go under Take Assessment, you can look at the PDF and study it and see if it's something you're interested in. But really what you're looking for are those factors that are most important to the person, so those that are marked as high importance, but that are also the furthest distance from being optimal. So for example, for the first question, satisfied with life roles. If the person marks a 1, that means they're very satisfied with life roles. So that's not going to be an OT goal. But if they mark dissatisfied with life roles, that might be, and that it's high importance, that would be an area that you'd want to explore in occupational therapy. The nice thing about this is that it figures out the highest scoring factors or questions for you. And that's thanks to Jessica Bolduc, who said, OTs really don't like to add and subtract. And it's a very complex adding and subtracting because some are, it's switched around and so forth. So anyway, look it over and let us know what you think about it, because that's the most important thing, is evolving these tools to make them better and better. So thank you for listening. I do want to give a shout out to Jessica Bolduc, your MIOTA president, because of all her help with the assessment tools and with the websites that we've developed. I can give you references upon request. I'd be happy to talk to anyone individually or do in-services for your group, because I need a lot more than 5 minutes to go over these tests. But at this point, this is what we have. So I hope that you will go on the websites, and I hope you will let me know. And again, thank you for listening. Goodbye.